Can you introduce yourself to me, please?
Okay, well, my name is Dr. Sunil Daga. I'm a consultant nephrologist at St James's Hospital in Leeds.
And can you just explain to me what it's like for patients living with kidney disease or kidney failure?
Well, kidney failure is, as you know, kidney is one of the major organs of the body. It is vitally important for many aspects of health, from clearing the toxins that are produced in the body to actually healthy bone and energy levels. So when people have kidney failure, their quality of life is most severely affected because they feel tired, they feel lack of energy, and then particularly when they are on treatment such as dialysis, that even take away a major part of their life. Almost every other day they would have to visit hospitals and spend up to 6 hours including transport. So that is a major burden on their quality of life. On the financial aspect, you would expect they would not be able to work full time. If they are young families, they can't give time to their little ones. They can't see their growth, they can't attend schools. So it's a really tragic disease somebody have to live with until they get a kidney transplant and where they could assume a reasonable normal life.
And how long do patients wait for a kidney transplant when they're on the list?
So things have improved over the years. So currently, on an average, patient has to wait 2.5 years on a national waiting list. And it also depends on the blood group and ethnicity. So for example, ethnic minority patients have to wait 6 months more than counter white Caucasian, but generally it's 2.5 to 3 years. And that's a very long period because it's not just about waiting, but a lot of people are no longer fit. They accumulate various disease and are no longer fit enough to have transplant, which means they have to live rest of their life on dialysis. So it's really important if something can be done to shorten that waiting time.
And once a patient gets called in for a transplant and they have a transplant successfully, how does their life change?
Once they have a kidney transplant, about 94% of the kidneys are successful this year, working well at the end of the 1 year, and people are living longer with a single kidney that they receive. On an average, a kidney can last up to a decade or more, depending on other conditions, and they get real normal lives. So they are able to do things that they couldn't do. They can have their family life. A lot of people go back to full-time work. There are people who go back to education, finish their degrees. So it's a real life-changing, and you need to remember that a disease can affect anybody from a childhood to elderly person to a person in the university, person is highly filing academic. It can hit to anybody. So having a kidney transplant means going back to your normal life.
So do you have children and adults on your list waiting for kidney transplants?
Yes, at Leeds we have both the waiting list. I predominantly look after adults. We have around 450 patients on the waiting list waiting for a kidney transplant.
So looking forward, how do you think the community can help us engage more people signing on to the organ donor register?
I think it is a social issue if you see that way. A lot of people, particularly the disadvantaged people like Black, Asian minority people, feel let down by their own community. We know that, for example, last year, 900 patients from BAME community received an organ from deceased donor waiting list, and only 110 were from Black, Asian, ethnic minority. It is really important. It's not just number, because having community coming forward and registering organ donor means they will get a better matched organ and an organ that will last longer. I think it's everybody's job because the disease don't see you. It can hit anybody, and the community can do a number of things really. So for example, they could want to hear more about the facts because there are a lot of fake news going around. So I think it's really important for leaders in the community to organize health seminars. As a team in Leeds, we are very pro. We can go and help them talk about the facts, talk about any concerns from the medical side. We also have a team of people from religious aspect who can go and have a one-to-one interaction with the community. So there has to be some initiative from the community to engage with us, and we will definitely help get there.
And if you've got one message to send out today, what message would that be to the people listening?
I think you need to know that you could be the next one who will need an organ donation. You need to act now, know the facts, talk in the community. It's very relevant for the community. So please come out, learn the facts, and discuss within members of team.